Hi guys, I'm Dr. Lee. Today I'm going to talk about the case of osteoarthritis combined with a varicose deformity of lower extremity. I usually emphasize that when treating the osteoarthritis, especially in young patients, it is most important to correct the bow leg or long knees if the patient have this kind of deformity to treat the osteoarthritis. Today, the case is long knee case with osteoarthritis. Let's see. This is the X-ray of lower extremity of the patient. I hope you guys see and analyze where is the problem and which deformity the patient have while I'm telling you the past history of this patient. The age is 36. It's very young age of man. The patient had the procedure in the right knee of arthroscopic surgery in 2016. Now the current problem is that he has pain in the lateral side of the right knee. The lateral side means if you look at the knee, here is the medial side and here is the lateral side. This patient has the pain around the lateral side. He doesn't feel good in the right ankle as well. Especially he feels discomfort in the right ankle and knee, especially when he walks for long. What's the biggest problem of this patient? This is the mechanical axis of lower extremity. Mechanical axis starts the center of hip joint and in the center of ankle joint. The point where the mechanical axis passed around the knee is important. When you see the left side, the mechanical axis goes around the center of the knee joint. This is good. When you see the right, this axis goes to the lateral side of the legs. That means the weight is concentrated on the lateral side. When you see the X-ray, the knee joint grossly from anterior to posterior, the medial compart, and here is lateral compart. If the axis go around the center, the weight is distributed evenly like this. But the mechanical axis go through lateral side. The weight of this patient is only loaded on the lateral compartment, not in medial compartment. So this is not good for the knee joint. When we magnify this part like this, mechanical axis goes through the lateral compartment. This is MRI. When you see the MRI, this is medial compart and this is lateral compart. Can you see the differences? Here, the black line is the end of the bone, and the gray area below this line here is cartilage. Here is also cartilage. So when you see the medial compart, this is very healthy joint. But when you see the lateral compart, here is healthy cartilage, but around here, you can see the cartilage is thinned around here, and we can see the defect of cartilage. Similar finding is observed in another cut. Here is not healthy area. And when you see here, this is healthy bone. But when you see around here, you can see white color in the bone. That means there is a water element in the bone. This is a kind of edema, bone edema. Bone edema means this area is under big stress. This bone edema is definitely finding of around here is not good. When you compare the X-ray, this is very interesting but very typical in osteoarthritis with malalignment. The line of the mechanical axis past here is actually similar portion where bone edema is observed and the joint cartilage is damaged. So this finding tells us what should we do to correct this condition. This is the plan. The first is correctional osteotomy. That is the surgery to correct the long knee deformity. And the second is treatment for regenerating cartilage, because we saw there is cartilage damage. There are many kinds of procedures to enhance cartilage regeneration. We also consider stem cell therapy. But most important thing is that if we should choose only one treatment for this patient, correctional osteotomy is the most important thing. I see many patients has over expectation for stem cell therapy. Suppose that we do only stem cell therapy in this patient and do not corrective osteotomy. What will happen? This condition, the malalignment, this environment is the most important factor of osteoarthritis in this patient. Without correcting this condition, any stem cell therapy doesn't work. If the patient has malalignment, varus or valgus, and osteoarthritis, the most important single treatment is correctional osteotomy. And stem cell therapy is additional to enhance cartilage regeneration. The osteotomy I did like this is very special osteotomy for distal femoral deformity. You can see small incision like this, but it's not, the small incision itself is not that important. The important thing is this surgery is done by minimal invasive technique. Minimal invasive means I don't use electrical saw during cutting the bone. That enables avoid heat damage of the bone and minimize the soft tissue injury around the bone. Okay, you can see only 2 months after surgery, you can see very nice callus is formed. This is not always observed, but during any kinds of osteotomy, distal femur, proximal tibia, the most important thing is accurate correction and minimal invasive to bone and soft tissues. That minimize the chance of any complications. Now, this is arthroscopic finding during the surgery. You can see this is a healthy cartilage. Around here is damaged cartilage. I think you can imagine the very similar with MRI findings like this. So when we clear the damaged cartilage, here is the definite area of cartilage degeneration. So I make some hole around here and implanted cartilage. In Korea, we have allogenic umbilical cord derived mesenchymal cell cartilage product. The name of the product is Cartistem. This is 16 months after surgery. Patient came to me to remove the implants, these metal plates. And you can see the axis of the right leg changed like this. The mechanical axis goes through the center of the joint, a very nice point. Most important change in this patient is this one. The alignment is corrected. This is the most single important change. And you can see the defect site, the cartilage is regenerated like this. It's very nice. Of course, the regenerated cartilage is not as good as original cartilage patient had, but I think this is quite good. Today I showed you a NANGNI, valgus deformity and osteoarthritis case, but all is same for bow legs, Xenuvara. Actually, Xenuvara is way more common than Xenovalga, NANGNI. I want to tell you one patient story. He came to me from Arabic and one of a lawyer family. He had the bow legs and osteoarthritis of the knee joint, and he wanted me to do the stem cell therapy for him. So I explained, like today's case, you have varus knee and the malalignment. So the most important thing to your joint is osteotomy surgery, and stem cell therapy is additional. Only stem cell therapy without osteotomy, it doesn't work. But I felt that he didn't try to understand this. So finally, he didn't get surgery from me, but I didn't change my policy of treatment because the only Cartistem therapy totally doesn't work for him. So today I want to emphasize this principle. If you have varus or valgus or any kind of the malalignment, deformity of the leg, the most important treatment is correct that deformity.